Okay. Good morning, afternoon, everybody. This is Jackie Orr with NASCASP. We are really happy to have all of you join us on this Friday before the weekend. I will be doing the webinar today, and along with me is my colleague, Katie Kajowski. So let me give you a little bit of housekeeping, things that you should know before we get started. So all of you are muted, so we are going to keep you on mute for basically the presentation part of the hour and a half we're together. And then as we get closer to the end, we'll unmute you, so at that point you could ask questions verbally to us. At any point in time, we'd like you to send your questions. So you have questions meanwhile, please, you can send them through the chat window. And also, Katie and I have set up the webinar that we are going to be asking you questions along the way. So we would like, and that will be before you're unmuted, so what we would like is to have you send your responses through chat, and we'll be able to see them, and we'll be able to answer, or to at least be able to read out some of your responses that way before we unmute everybody. Again, we thank you for joining us, and particularly I'd like to thank Shauna and Regina at the state office. They invited Katie and I to do this webinar, and we like being able to do things for activities such as this for our state office and to engage all of you at community action agencies as well. So that, I just introduced myself, so I'm going to turn it over to my colleague Katie so she can introduce herself.
There. Thank you, Jackie. My name is Katie Kajowski. I am the Research Director with NASCASP, and I'm really happy to be here with you all this afternoon talking about community needs assessment.
Thank you, Katie. So so this is the agenda. So I think you all saw the description when you registered for the webinar. So what we're going to do is Katie and I are going to be moving the presenter ball back and forth, so to speak. So we're going to start with an overview of the community needs assessment process. That's going to be fairly brief. Then we're going to be talking about identifying needs, outcomes, services, and strategies. And we're going to be relating that to specifically using the needs that we talk about and that we're going to be identifying some needs. So we're going to be using those identified needs and specifically looking at this community national performance indicators and the family and individual national performance indicators from the annual report, as well as the services and strategies. And then we're going to be looking at integrating that we've identified from the needs assessment into your community action plan. And we're also going to be talking a little bit, very briefly, a few slides about the connection between the needs assessment, the strategic plan, and then your community action plan. And then we're going to be closing at the end of the webinar. We're going to be talking about how to allocate your CSBG funds, and we're specifically going to be taking a look at Module 2 and the expenditure domains. And then we're going to have some questions for you, too. We have some examples about thinking about where you would allocate funds among different programs.
Hey, I'm just going to jump in quick first. We had a couple questions of this webinar. We are recording this webinar, and we will make the slides and the recording available to you all following the webinar.
Yes, thank you, Katie. Yes, we will. You'll get everything that you need. And I'll be able to send out the slides right after to Regina and Shauna. The recording will take a little bit longer for us to do that and upload it and get the link to all of you. Again, I said we were going to talk about the community needs assessment, do a brief overview of the process. We do an entire day training on how to do community needs assessment. But we know that really wasn't the point of this webinar. But what we do sort of is want to set the stage. So we make sure that we talk about what the pieces are of a community needs assessment. So the first thing is, why do we do a needs assessment? It is part of our laws, part of the CSBG statute. It's actually one of the few very clear things, I think, in the statute that talks about that the state will secure from each eligible entity in the state a community action plan that includes a community needs assessment for the community served. So that's why you see those pieces are part of your community action plan that you send to your state office that typically is part of your application process. It does note that these needs assessments can be coordinated with other programs. We know for agencies that have Head Starts, then Head Start Head Start programs also need to do needs assessments. So often doing a needs assessment for CSBG and Head Start can be coordinated and worked and done a good job of working together to create the needs assessment. Even more, in some ways, importantly, and it certainly has come to be something that we pay a lot of attention to, is organizational standards. So I think organizational standards has kind of put a lot of more focus, I guess I should say, on the community needs assessment. So we know that Category 3 is specifically focused on the standards related to needs assessment, but there are other standards related to needs assessment processes throughout the standards. So we know that we need to have one done every 3 years. It has to be approved by the board. We need input from folks in the low-income community. We need to get input from a variety of different kinds and types of organizations, and that we need to take a look at the causes and conditions of poverty. So those are just some of the few things that have more put more teeth, I guess I should say, into a community needs assessment and really what that should look like. We all have a connection to ROMA. I think just about everything we do in community action has a connection to ROMA and our ROMA cycle. So when we look at Information Memorandum 49 in particular, because I always think of this as the ROMA IM, this speaks to the board, and that the Community Action Agency and its board has to complete regular assessments of the agency and look at overall mission. And actually we'll be talking about mission too, our desired impact and program structure. And in doing that, one of the things that the agency and board has to take under consideration is the needs of the community and its residents. So again, that's another place where we see the importance and the value of needs assessments. For all of you who are engaged in needs assessments, you know that when we do a needs assessment, it really paints a picture of what our community looks like. So we obviously focuses on needs, I think, in many ways. We would call it a needs assessment. But when we do a needs assessment, we look at the assets that are available in the community. We look at the resources, what is out there. Are there resources to be able to meet some of the needs we're hearing about? We also take a look at gaps and barriers and emerging needs, and not only that, what is available now that may not be available in the future. We know that there's not. Maybe there's some funding that's going to dry up or going to decrease, and we know that. There are some policy decisions that may be taking place in the state, so we know that some of that might look different. So it really creates a true picture of our community, and I think the important thing here when we look at this slide is that we look at the entire community and not just the needs and issues the agency has programs to address. So it's beyond your specific program structure and your specific services that you offer as an agency. We'll talk briefly about the community needs assessment process. Katie and I actually shortened this a little bit because I think there's more steps, but that's not the point of what we're talking about here. So we've just talked about, we'll talk briefly about creating an assessment work group, the selection data, select the data methods, and the collecting data. I think this is where agencies tend to focus because you need to know what kind of data you're collecting and then how you're going to collect it. Analyzing the data. So now that you have that data, what does it all mean? And then, of course, preparing the report, and that is equally as important as the rest of the pieces because you have to be able to put it all together and have it say something that's meaningful. And we know in the organizational standards that you also have to make sure that the report is available somewhere for folks to be able to see. Look at the assessment work group. This is just, and it could be anything. You can call it, some agencies call it the assessment team. Some, it really, the terminology you use doesn't really make as much difference as that it's important that is a work group that works on the community needs assessment process, and it's not one person. I used to work at the Community Action Association in New York before I came to NASCAP, and I used to help agencies with their needs assessments, and I know that there were many agencies where their one person was responsible for the needs assessment. And that one person had a whole entire job that outside of the needs assessment. So it should really be a collaboration of folks at the agency that can include all the folks the names and titles that you see on your slide. Certainly you want to have agency staff, and particularly if you have planning and development experts on your staff, certainly board members, or at least one board member who then can update the rest of the board members at their regular meetings, if you're using consultants. And then if you have particularly strong relationships with other organization leaders or community partners, you may also want to include that in your work group. I think now that we have the organizational standards, it's become more clear, more important that we have a work group and agencies who do the needs assessment and conduct that process, because when you're looking at the causes and conditions of poverty and doing that analysis, it certainly needs to be a collective effort, and it can't just be one or two people who are doing that. Is collecting data, and this is going to be my first questions to you. As I said, we spend probably the majority amount of time thinking about the data. What data do we need? How do we go ahead and collect it? So as you know, those of you I know who are ROMA trainers, if you've been to a ROMA training, we spend a good amount of time talking about what quantitative data is and what qualitative data is. So we have quantitative data, and we think of that as the number data. So for those of you who are particularly involved in your community needs assessments, I'm going to ask you to chat in and give me some responses as to where do you find quantitative data when you're doing your needs assessments. And as you can, I'll read some of the responses. Okay, any responses? That you use that you find particularly helpful for you when you're looking for that quantitative data? I think about that I know many agencies use and I think is very valuable is community commons. Commons in many ways is a one-stop shop for agencies, and it has much of that data that we think of when we think about doing needs assessment, and you think of the demographic data, and you think of needing to know how many folks are living in poverty, and of those folks living in poverty, what are the age breakdowns of those people, or the racial ethnic breakdowns of those people, how many, what is the unemployment rates, any information like that we can think of as quantitative data. You can use Community Commons, which I think is a great resource for the network. I think it means now that we have that, we spend a lot less time collecting data, because it is that one good place to go to get a lot of it. Not all of it, but certainly a lot of it. But I know there are folks who also have used the Census Direct website. So you could certainly use that, and I know there's lots of statewide data that can be had too. your state, your Wyoming Department of Health, or your criminal justice site and all that. Those are places also to go for that quantitative data. Okay, thinking about qualitative data, we're thinking about words. We say words to think of it being the opposite of numbers, but also thinking here of that anecdotal information, stories, narratives, what people are actually telling us. So can folks let me know where you go to get that qualitative data? How do you gather that?
People are wondering, you can put this into chat that's on the right-hand side of your screen or into the Q&A box.
Katie. Are there any ideas?
Like we have.
Do we have
surveys? You said surveys to get the qualitative data. Yeah.
Absolutely. That great response. Surveys is, I think, one of the best ways to get that qualitative data. And when you think about surveys, too, we can also gather the quantitative data with surveys because we can, aggregate some of that data and say X percentage of people are X number of years old if you're collecting demographic data. So I think surveys help us on both ends, because it gives us the quantitative data, it gives us the qualitative data. People have said this. So I think that's great. Also, when you're thinking about qualitative data, in addition to surveys, I know that many agencies do focus groups. You have conversations about the survey data. You do surveys and you say, wow, these are the three priority things that got noted by survey respondents as like the three biggest needs in our community. So they bring that into a focus group and you say, okay, let's talk about that. What does that mean? So that's a good way to get qualitative data, as well as, so what I'm thinking, interviews. Agencies do interviews with, sometimes even interviews with your board members or your community partner, executive directors, or other noteworthy people in your community, maybe your mayor or your county government official, or something like that. So that's another good way of getting that qualitative data. Okay.
So I think we have a hand up.
A hand up. Okay. Who would that be?
Regina.
Are you going to unmute?
It looks like, Regina, I think we've unmuted you.
So I was having a hard time finding the chat box. Sorry, the chat box. But I found the hand. Just as an FYI, most of the Wyoming grantees, they actually contract out for their community needs assessments. And so, in asking those questions about, how is that information collected and stuff like this, how do they do that? For on the call from Wyoming, if you're contracting it out, you might, in response to some of these questions, answer in regards to how does the vendor that you're contracting with do that.
That's a good point. I know that there are a number of community action agencies who do contract out. And, I think it's whatever works best for your organization, whether, you have the capacity to be able to do it with existing staff or whether you contract out. But it should be things that you think about so you can make sure, hiring contractors who clearly have experience and expertise in the field, but it'd be one of the things that you may want to guide some of that too. Like you want to do surveys, you want to do more or less surveys, you want to do more or less focus groups, so it should be something that you also can have a hand in. But thanks for that, Regina, that's helpful. We're going to wrap up our overview of the community needs assessment process. And here we're just going to speak about engaging stakeholders through data collection. So as you're looking at the data that you're getting from your contractors and other folks who might be helping you do needs assessments, you ensure that all these groups are being included. You know, you're getting information from the general public, you're getting information from community organizations, certainly key partners, those organizations that you work really closely with, or those groups of people that you work closely with, as well as your customers. You want to make sure that multi-level data is being collected. So you can think of it from macro to micro. So you make sure you're looking at, you get the national picture. You definitely want to see the state picture as well, maybe specific regions within your state, certainly more your community and more your service area, and then the target population. So you collect data on all those levels, and then you can say, you know, that's a good picture. So what's happening at national level, state level, but then really what's happening to folks in my area, and particularly my target population. Okay, moving on to Katie, because Katie's going to talk a little bit more about the needs that are when you're looking at a needs assessment. But before I do that, does anybody have any general questions about the assessment process? Okay, then turn it over to you, and I'll see if I can watch out for questions.
Okay, great, Jackie. So now that you've gotten this information, you have survey data, you have census information, you've looked at your community on a variety of different levels. Going to take next steps with that information. And consider all of the information to identify the needs in your community. Next slide. Next slide, please.
There we go.
Thanks. Thank you. So we'll talk a little bit about analyzing the level of need. This is the purple square on the process that Jackie presented a little bit earlier. Oftentimes we see community needs assessments that list issues written as needs, basically. And they are saying then that these are the needs. But to have listed things like that, housing, education, transportation, or employment, these are very broad categories to determine how the agency is going to actually address them. So what you really want to do is look at those categories and use the information you have. Next slide. Determine the level of need at the family individual level, at the community level, or the agency level. So that's really identifying whose need is it. Is it family's need, housing, or that the community lacks the housing, or that an agency doesn't have capacity? So let's look at a few examples here. An example, just like I said. So there'd be a lack of affordable housing, and that would be a community level need. Or perhaps from all the information you've collected, you've identified that it's individuals who are at risk of losing their homes. And in this case, you'd be addressing that individual at the individual level, providing the services or meeting the needs of individuals and families. Or maybe the agency does not have the capacity to meet the housing needs. So that would be an agency level need. So I see you would be addressing all of these differently that they exist. Thank you. For transportation, let's take a look at this. You might identify that it's staff that need to be better informed about transportation options. That is an agency level need. Or maybe there's a lack of public transportation routes that then be addressed at the community level with community level initiatives and strategies. Or perhaps people help with their own personal transportation, and that is addressed at the individual and family level need with services that are getting folks the transportation that they need. For employment example, maybe you identify that people need to learn skills to get jobs, an individual and family level need. From all the information you've collected about your community, you identify that there's a lack of job in the community. So even if people have the skills to get jobs, they just don't exist in that community. ROMA needs more resources to expand its employment program because there are jobs in the community or people need to get skills to obtain those jobs. So your agency needs to expand its resources to be able to help people. You may identify a number of needs in your community, but you should also recognize that your agency cannot possibly address all the needs that they identify. Maybe the need itself doesn't connect with the agency's mission. A need arises that would be better served by another nonprofit. Maybe the agency doesn't have the expertise within its organization or the capacity to grow that expertise. Or simply the agency doesn't have the funding or other types of capacity issues that exist that would be a barrier to addressing any of the needs identified in your needs assessment. Or may already being addressed and, working with partner organizations and referring customers, and that's how you're working within community to address the needs because others are already working on it. So some things that you can think about is what role will the agency take addressing those needs, and they will prioritize them in during the things that your agency can do to address the certain needs. I'm going to turn it over to Jackie.
Yep. All right. Thank you, Katie. And if you have any questions or comments throughout, you can, as Katie said, you can indicate it in the question and answers or through the chat. But I did see that, and I think Katie already responded, but someone did ask, does it apply to community needs assessments? Do they apply to private community action agencies or public community action agencies? And the community needs assessment process applies to both public and private. The way it's done could be different, and most likely will be different. And it could be if in a public community action agency that it might be the community needs assessment might be a piece of a larger needs assessment that was done by the county. Say that if you're in a public cap and it's a part of a county, the county may have done a needs assessment of their county services, and then there might be a piece of that that's more related to specifically community services block grant. But those standards that are related to community needs assessment are both applicable both to public and private. So, and what Katie was talking about, again, being a public or private cap, how the agency is going to be responding to the needs really makes defining those needs is critical to how an organization is going to respond to the needs in the community. So understanding that level of need is important because what outcomes that you're looking to achieve, that the organization is looking to achieve, and what services and strategies that are employed or that are used is going to make a big difference through your understanding of what that level of need is. Right now, we're going to hopefully make that connection even more clear to you. So Katie went through those levels of needs. So now we're going to connect that level of need to outcomes, services, and strategies. And then this is the point where we'll be bringing in some of the information from the new CSBG annual report to make the connection between needs, outcomes, and then how that ultimately gets reported through the CSBG annual report. So that we've identified the level of need, that we're going to be able to, our organization is going to be able to determine the outcome or outcomes. I mean, oftentimes there's more than one outcome for an identified need. And then through that, the organization is going to be able to determine what those services and strategies will be in order to achieve the outcome. And for those of you who know more or less about ROMA, we always talk about the identification of the need, and then immediately we think about what the outcome looks like, and then we sort of back into what those services and strategies are going to be. So here we're going to look at those examples that Katie talked about when we identify the level of need, and then we're going to be looking at, okay, what is the outcome? So this is the need. What is our result? What do we want to achieve? A lot of times when we think about an outcome, or we think about a need and then we think about an outcome, the outcome in many ways is kind of opposite of the need. So here Katie mentioned that we have a lack of affordable housing in our community. Well, what we want to see, the change we want to make, is that there's an increase of affordable housing in the community. Kind of seems like a no-brainer, but that's what we want. There's not enough of something, so we want to make sure there is enough of something so that it meets the needs of our folks. How we get there is different, and that's what we'll talk in a minute about how we connect that with the indicators and the services and strategies from report, or just in general services and strategies. So the next need that we've identified, individuals are at risk of losing their homes. So here our outcome is that we want to make sure they remain in their homes, and we're going to do X, Y, Z in order to make sure that that happens. This is an agency-level capacity issue. Agency does not have the capacity to meet the housing needs. And this could be public or private. It doesn't make any difference. We have capacity issues in public and private agencies. So here, say that one of our outcomes here is that we're going to have agency staff are going to become certified housing counselors. How to do that? That's what we're left to have to figure out. But that's one of our outcomes. And we'll pull that Katie talked about. We have the transportation. We hear this often when we go to estates, both public and private cabs. We say there's always not enough transportation. Transportation seems to be one of those issues and needs that rises to the top. So here we have an agency need. The staff lack expertise, so now the staff are going to become knowledgeable about the public transportation system. So how are we going to make sure that our staff have some expertise in what's happening around transportation? So here, community level need, there is a lack of public transportation routes. So our goal and our change is going to be that the public transportation routes increase. Now, that's like a big thing, because you think about that could encompass a lot. It could be that they are now increased into different communities, so the number increases. It could be that their times are different. It could be where they go, where the public transportation actually gets to is changed. So that's a loaded one, but that's sort of the North Star. That's where we want to go. And our last need, our individual and family, people need help with their own transportation. So, public transportation, that only solves parts of our issues in communities. But here we have that people also need help with their own transportation, because sometimes public transportation is just not adequate. It's not what I need. So I am my organization, I think that I also need to help people have increase their access to their own personal transportation, and what am I going to do to help that? The last example we're going to look at is those employment needs and outcomes. So employment is also another one. We know that, the people are unemployed or underemployed. So agencies spend, I think, lots of time and CSBG dollars looking at how we can better employ folks. So people need to learn skills to get jobs. So that is that we're making the assumption here there are jobs there. So what we're going to do as an organization is we're going to help people we're going to help give people skills so they can get those jobs. And we say but we have within the employment, we still have a need. There's a lack of jobs in our community. So what we are hoping is that we're going to see an increase in the number of jobs in our community. And that, again, as our agency, we need more resources to expand so we have an employment program at this organization. So now what we need to do is we need our resources to expand our employment program. So one of our outcomes here is that we obtained a WEOA grant. So how are we going to be able to, that's what we want. So how are we going to help that happen? So before I turn it over to Katie and she gets into the service and strategies, again, whether you are doing your own needs assessment or whether you're contracting out, the end result of the needs assessment should not say that these are, we have a housing need. Well, it could say that, but then it has to be more clear. We have a housing need, we have an employment issue in our county or our neighborhood, our service area, because as an organization, how you respond to that need is going to be very different. What your outcome looks like and what your services and strategies you use are going to be very different depending on your understanding of the level of need. So I think I am now turning it over to you.
We have let's see if we have questions really quick.
And again, if you want to wait until the end, we'll unmute you, and then you can just ask us, and that would be fine.
Okay, great. So now we need to look at this connection between the need, the outcomes, the national performance indicators, the community performance indicators, and of course the services and strategies that help us meet our end goal. So we'll take a look at how we can select some of these indicators based on the need and the outcome. So back to our original housing example here, that have individuals are at risk of losing homes. So inside that we are helping individuals and families at that individual and family level. As Jackie brought in, the outcome to meet this need that we hope to achieve is individuals remain in their homes. So that's the end goal, as Jackie said, which I really like. That's the North Star. That's where we're going. So then when we take a look at the indicators, when we tell somebody how we know we got there, well, we would report on the number of households who avoided foreclosure. So then to meet the outcome, I mean, obviously there's a lot of things you can do. Providing services such as financial capability skill training, financial coaching, counseling, payments. So the services that we're providing individuals and families to help them remain in their home. They are reporting on it. We're using the indicator of the number of households who avoid foreclosure. Of course, there could be other indicators that you could report on from achieving this outcome. Let's take a look. The housing example at the community level. Remember, we talked about that there is a lack of affordable housing within this community. So the outcome then, as Jackie mentioned, is that there's an increase in affordable housing in the community. Some of the services and strategies that we're offering to get there are new affordable single-use housing creation and housing policy changes. And the indicator that we're using to report this outcome is FNPI 4A, the number of safe and affordable housing units developed in the identified community. So this is how these parts and pieces are connecting together. Next. Take a look at the employment example for individual and family level. So that our need that people need to learn skills to get jobs. Okay. So we said, okay, if that's what people need, then we are going to get individuals some skills to obtain jobs. So we identify in the services that to meet that outcome, we are going to provide vocational training on the job and other work experience. We're going to have some apprenticeships or internships, and of course we're going to have some job readiness training. So then for the folks that are helping to increase skills to obtain jobs, we're going to report on them in FNPI 1B, C, and H. This is an example of where you can report multiple. You can put in multiple indicators. FNPI 1B, the number of unemployed adults who obtained employment, because we got folks with skills to obtain jobs, they got jobs. FA1C, the number of unemployed adults who obtained and maintained employment for at least 90 days. So in this case, we're able to track these folks for up to 90 days. FNPI 1H, the number of employed participants in a career advancement-related program who entered or transitioned into a position that provided increased income or benefits. We helped these folks obtain some skills through the services that we offered, able to transition into a position that paid better or offered better benefits. And that's the that we would then use to report on that. Shoot. I'm just trying to advance them. So let's look at another example here. This is the last one we'll take a look at. There's a lack of jobs in our communities. That's a community level need. We're trying to get our community to have more available jobs. So that we're going to employ to meet that outcome is job creation, employment generation, and employment policy changes. Then we've selected the indicator that we're going to report on, CNPI 1A, the number of jobs created to increase opportunities for people with low incomes in the identified community. So as you can see, everything starts with our need, from our needs assessment that we've identified at a specific level, because it helps us then determine where we're going with this, the type of strategies we want to employ to get to that outcome, and then how we're reporting it in the report with the indicators that we select. Does anyone have any questions on this before we move along? Okay, over to Jackie then.
Okay, thank you, Katie. And those were just a sampling. We wanted to make sure that you could see, as Katie was explaining, the kind of like the logical flow, and those are just some of the indicators and services and strategies we put out. There are most likely more, but, it didn't seem worth it to all of those, but then I give you an idea of making connections. So here, we are going to just talk briefly, I mentioned at the beginning, about the strategic plan, because that is sort of, I think of it as like at the middle piece. We've done our needs assessment, we've identified our needs, and where they're going to actually show up in that CAP plan, but that agency, meanwhile, is doing a strategic planning process. So there's questions that we can ask ourselves, and when you think I've already actually said this. So we have the community needs assessment, the strategic plan, and the community action plan. All those pieces are connected. There are in many ways separate processes that you use, but one fits into the other. They're all integrated processes. I did want to also mention to the person who asked before about community needs assessments and the public and private community action agencies. It's the same for strategic planning. If you know the organizational standards, that is organizational standards in 6.1 through 6.5, and strategic plans are also expected from both private and public community action agencies. Again, it could look different. I worked with a state recently in helping them look at their organizational standards for their agencies. I think all but 3 agencies were public CAPs. So there were only 3 that were private. So I saw lots of different variations of both, needs assessments as well, but more so I think even in the strategic plans, and that, the department or the larger government that they were a part of had a strategic plan, and then it was how they fit into that strategic planning process and document. So we'll definitely look different between private and public, but those standards are still applicable to both. I think these are great questions when an organization is moving from their community needs assessment to their planning process, which should ideally, in a perfect world, is done pretty much right afterwards. And I know in the organizational standards that we don't have it matching, so to speak, because you do the needs assessment 3 years and the strategic plan every 5, which is a little odd, but that's the way it happened. But I think is always a good idea, at least when you're starting this process, that if you haven't done it in sort of that way or that approach before, that you come off your needs assessment and within a year you've done your strategic plan, because then everything is fresh on your mind. These, I think, are great questions, and I call them the bridge to planning. They are actually they may be a little reworded, but they're part of the introduction to ROMA curriculum. So for those of you who are trainers or you've been through it, they might look very familiar to you. So now agencies have done community needs assessments. And think about, these are the questions when you're looking at doing your strategic planning process. And I know Katie has sort of already approached some of these and talked a little bit about these, but what can be done to address the need? Who should address the need? Not necessarily your agency, public or private. What need are you best positioned to address? Do you do that alone? Do you do it with partners? What capabilities do you have? What existing programs are that can address the need that are already within your organization? You have to think about the resources required, and what could you change? Sometimes is that there is a existing program that could be expanded, or the focus of that program perhaps changed to address a need that you've identified through your needs assessment. Then again, where you're thinking, you're going with your plan, what can you reasonably expect to accomplish within the next few years? These are good planning questions to ask after you've done your needs assessment and as you're preparing for your strategic plan. So this talks about that the assessment provides a foundation by identifying the needs and the strengths and the assets in the community. And during the planning phase, the agency is looking at their assessment data and always going back to that mission, because we said you're going to identify needs in the community that you're not going to be able to address necessarily as something that you would as an organization be able to address, because it might not be something that connects to your mission. So you look at the tools to identify the desired results that the agency wants to achieve. So those, the data and the mission statement, are your tools. The agency develops strategies to achieve those results, and then those get operationalized through your community action plan. That usually, like we talked about earlier, that gets submitted to the state office through your annual application process. All are very familiar with this. This is just a snapshot of your community action plan. So you know that it speaks to filling in the top 5 needs that you would have identified through your planning or through your assessment process. And again, from there, you would expect to see more than employment. You would expect to see employment being identified at a greater detail, greater level. And then it asks whether that is something that is going to be directly addressed by you, or is it going to be something that you're going to be coordinating with other partners. Separate entity. Okay, look at allocating CSBG funds. So we've already talked about being clear, identifying your need, how that connects with your outcomes, how that then connects with the NDIs and the services and strategies that are found in the new CSBG annual report, and then you realize that within all this is talking about, how you allocate and how those funds. So Katie is going to be talking about that. But meanwhile, if you have any questions, please let us know.
Jackie
still has her hand up. Does that mean she still has a question? I'm sorry, Katie. I just interrupted you.
That's okay.
I think. Okay.
Thanks, Regina. So as Jackie mentioned, the next thing is think about how you want to allocate the funds. And if you could go to the slide, please.
Oh, yep.
Thanks. It's a screenshot of the Module 2, Section A, the expenditure categories. These are organized by domain. As you're thinking about where do I allocate my funding, and then ultimately where will I report the money that I spend on these programs and these projects that I've been doing, you're really looking at this by domain. So as we've walked through the needs, the outcomes, the indicators, we all started somewhere with a domain, right? You know, the employment. People need skills to obtain jobs. That's under the employment domain. So you would consider then putting the funds spent, your CSBG dollars spent on employment on that particular program in the employment domain. As you can see, there's sometimes this could get confusing, right? A lot of the programs that we operate meet multiple needs that could be found under multiple domains. Sometimes you might just have to make a choice of what is the main need that I'm serving with this particular program. And then that's where you would allocate the funds to. We also have in this chart services supporting multiple domains. So in those cases where it makes sense, you may allocate the funding to services supporting multiple domains. For example, a family development program that really is working across all domains. We also have agency capacity building as chart. So remember those needs that we identified as agency level needs. There's not agency level indicators on the NPIs, but we certainly care about agency capacity building activities and the needs that you're meeting at your organization. So allocating funds to those activities, you would report them here. I'm going to go into it, but there's other places in Module 2 to talk about agency capacity building activities and those types you're doing within your organization to meet those agency level needs. We're going to take a look at a few different examples right now. So as you're looking at this and I'm talking about it and reading through it with you, if you know where you would report these funds in Module 2, please put that into the chat window. So for example, the result of needs identified in their community needs assessment, a community action agency has a goal to help individuals with low incomes move up the economic ladder. C is going to use CSBG funds to pay a few months emergency rent for some participants in a training program so that they can complete training program. So where would you report these funds in Module 2? An idea about that, we've got Module 2 on the right side of your screen. You can put that in the chat. So remember, they did a community needs assessment. Their goal now is to help individuals with move up the economic ladder. So in order to do that, they're going to pay a few months rent for doing a job training program. Support that. Any ideas or thoughts on this? I'll share with you what we think, that it could go in employment or housing, and that this can be made either way, right? Because these funds are paying directly for the rent, so that's housing, but it's paying for rent for a participant in an employment program that is helping them gain a better sense of employment or a better employment situation. So because they're in that employment program, you could dedicate those funds to employment. Sometimes we talk with folks about this is how you're also telling your story. You know, you've identified your needs, your outcomes, you're reporting in certain indicators, and then you're allocating the funds. So if you're spending a lot of time in employment, I would consider reporting rent payment under employment. Let's talk about the types of funds that you're spending on emergency rent and in that housing domain, then you have the ability to report it in the housing domain. So this is up to you. You kind of want to go back to those needs, though, with the original intent. here, what are we meeting, what's the goal of this program, and that can help you decide where to allocate the funds. For example.
Me to take this one? Okay. Okay. All right. So this is the Community Action Agency has a goal in its strategic plan to improve access to transportation. CSBG funds are used to support an executive director's time spent working a coalition to increase transportation in the city. So where do you think you could report these funds in Module 2? Screen on your right of all the expenditure domains. So where do you think that makes sense within your organization that you would be reporting these funds? Does anybody have any? Okay, so this is our suggestion, and you would report it in linkages. Because if you back, I'm going to just go back with you for a minute. When you look at linkages, it speaks to partnerships that support multiple domains. So when we look at this, I think executive director's time spent working on a coalition to increase transportation. This is specific to increasing transportation in the city, but it could be a coalition on a number of different activities. So here it makes sense to put it in, to put the expenditures in the linkages category.
Jackie, somebody chat civic engagement and community involvement.
Oh, yep. What? Yes, I agree with Katie. It could be that as well. Yep.
That's the most important point that we're making here is that is up to education, but this is certainly up to you all to decide as you're reporting your programs and planning for your programs and where to put this.
Yes, Katie. We have one more example, I think, and this is the Community Action Agency has a commitment to help individuals with low incomes meet their specific education, employment, and or other goals. The CSBG funds are used to support a family development program. So we report these funds in Module 2. This program, as we can see, works with a number of folks, and they're helping them meet a number of different goals, including in this example, both education and employment goals. So out of these expenditure categories, where I think it makes sense to report them. So we'll write it in. Okay, thoughts? Okay, let me show you where I think it would make sense. That is services supporting multiple domains. Because Katie talked about the services supporting multiple domains, and as the example, this program is a sort of wraparound case management program and helps folks meet goals in different domains. I mean, we specifically talked about employment and education, but there could be other domains as well. So it seems to make the most sense to be putting these expenditures for that program in the category services supporting multiple domains. Okay, questions about that? Okay. So now, let me get out of that. So I think we're going to be able to open it up to everybody, folks. Yes, sounds like everyone is unmuted. Make sure that we've unmuted you, that you mute yourself on your end. Otherwise, we'll get lots of noise. So you're unmuted on our end. Mute yourself on your end. But then, meanwhile, obviously, if you have a question, then you can ask us, or you can still take the liberty and go ahead and put it in the chat box or put it in the question and answer. Okay. So does anybody have any questions?
Hi, this is Shauna. So when we're talking about the NPIs and all that, can you, the goal, can you mark more than one PI per program? Or so with the linkage one, and then somebody else said it could also be, what was it, community something? Could you mark both of those, or is it you only mark one?
Are you specifically about module? Are you, Shauna, talking specifically about the module 2, the expenditures?
Yes.
Okay, just and Katie, you can correct me on this, but just one program.
Usually, you could do a spread if that you wanted to. I mean, we recommend one program, but there's no prohibition against doing something like if you spend 60% of your time on housing and 40% on employment. My opinion of that is that it complicates things, but there's certainly no that says you can't.
An answer, Jen, or did you want, or were you specifically talking about the national performance indicators too?
Nope, that was my question.
Okay, good.
Thank you guys very much for putting this together. I think it was very helpful and informative.
Okay, good. If anybody does have any questions, you can reach out to us. That's fine, or reach out to your state office. And if they don't have the answer to your question, they can always contact us. As Katie mentioned earlier, we recorded this, so we'll have the recording available. And as soon as we're done, I can go ahead and send the slides to Shauna and Regina so that they can get it out. All of you who were on the webinar and anybody else who they want to send the slides to.
Yes. And just for my information and stuff like that, I'd be curious to know who we have on the call. I see from the participant list, and I'm trying to identify, of course, our grantees and our sub-grantees. Is it okay with you if I just do a quick roll call to find out if they, because is everybody on this from Wyoming?
Because we did not send the link. The only person who got the link to the webinar was Shauna, so she's the one who sent it out to the network. But that would be a great idea, Regina, because we also have what we have call-in users, and there's no name because people have called in and aren't on the web but on the phone. So if you want to do a roll call, that would be great.
First, and before I do, I just want to say thank you to all those who did come to this webinar. I think it's awesome that you were looking for more information and maybe clarification. That's great. So I will start with how I got this. It shows up kind of on the participant list there. And I'm not sure if and I'm going to butcher this first name, and I apologize. Anita Sally?
Yes.
Where are you from?
Child Development Services of Fremont County.
Great. Daphne Palmer?
Yes. The meal services at Young at Heart.
Yeah. Sweet Springs. Thank you. Don Limburner?
I'm with Injury Prevention Resources in Riverton.
Good job. Holly Nielsen? Are you still called Emily? Is it Emmy? Or writing? Okay. Julie Price Carroll?
Is that you?
Pardon?
From County, can you hear me?
I can, thank you.
Julie is the vice secretary from Reproductive Health.
Okay. All right, thank you. Kathy Coleman? Still on the call? Okay. What about Kathy Siller? Oh, Kelly Buckingham? Okay, Christina, I know where you're from. And Laura, Matt Miller? I will not leave the call. Reggie Boston?
On the Action Committee in Fremont County, and we have sub-grantees under us.
Okay. Here. Anderson?
I'm here also from Riverton.
Okay. And then anyone who I see, I know where you're from. That's why I'm not calling your name. Thank you. Anyone else that's on the call that I didn't call out there?
Rita, this is Christina. You called Kathy Seiler. She's from the bank in Sweetwater County.
Okay.
And then you also said Emmy Nielsen,
Yes.
who's from the Rock Springs Young at Heart doing the in-home services program.
Oh, thank you. Any others out of Sweetwater?
Not that I noticed.
Okay.
You said Daphne Palmer.
She did respond. Yes. Any callers on here that we didn't have your name isn't called out? Like that. Okay, I'll choose out if that's where we're heading now, Jackie and Katie. Thank you so much for doing this.
Great. Thank you, Regina and Shauna, for inviting us to do this. And if no one has any questions, we will call it a day. And again, if you have further questions, you can reach out to us or Regina and Shauna at the state office. And I don't know if you wanted to close with anything.
Thank you all for your time today and thanking us. And yeah, with Jackie or myself with any questions that you might have.
Okay. Well, with that, thank you very much, and have a great weekend.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.